As the old saying goes, the eyes are the mirrors of the soul. So people tend to infer certain things about you. Oh, you're tired, you're angry, you're sad when you're not feeling that way. So then they may think that, oh, it's just the upper eyelid. But a couple of bad things can happen if you try to treat brow descent just with upper eyelid skin. Because what's going to happen is you're going to try to overcompensate for it, and the three-dimensional form isn't going to flow properly at all. Now, the key when taking a look at a patient like this is to, number one, look at the patient, of course, and examine them. Number two, whenever possible, we love old pictures for all of our facial rejuvenation patients because you want to maintain facial identity. So there's a lot of different options for brow position. In other words, if there's just a little bit of descent and you understand the dynamic balance of the forehead muscle, sometimes you can solve that problem very nicely just with Botox. In a situation where it's more severe or the patient doesn't want Botox, then there's a number of different brow lifts that we do in the practice. One popular one is the endoscopic brow lift, which has certain advantages. We make tiny incisions behind the hairline so there's not any sort of lengthy scar conspicuous. Just under local anesthesia, we can do what's called a subcutaneous brow lift, where I make a little incision along the hairline. I can come into the plane right under the skin. Upper eyelid surgery by itself is probably one of the best ratios for patients in plastic surgery in terms of the benefit you get versus the aggravation you have to go through.